Partnered by Times Influence.
Hello and welcome to a very special discussion titled Merck Presents Let's March Ahead and Unite Against Colorectal Cancer. Now, cancer, a word that unfortunately we are hearing too often nowadays. And there are a lot of cancers, but today this special discussion is going to focus on colorectal or colon cancer. Now, I'm joined by an esteemed panel of medical oncologists, but before I introduce them to you, I want to let you know that we'll be talking about colorectal cancer and that it is the third most common cancer in men globally, as well as the second most common cancer in women globally. So we'll be aiming to look and find out some of the causes for the cancer, what are the risk factors, and what can be done for you, for me, to find out how we can go ahead and diagnose it, treat it when required. Allow me to first introduce my panel of expert oncologists. First up on my right, Dr. Jaideep Ghosh. He's with the Tata Medical Center, Kolkata. Dr. Randeep Singh. He's with Artemis, Gurgaon. Moving on to my left, Dr. Kaushal Patel with Manav Daya Trust, Sankul, Surat. Dr. Vijay Agarwal. He's with HCG, Bangalore. And finally, Dr. Ashish Singh. He's with the Christian Medical College, Vellore. Welcome to the panel, doctors. Dr. Ashish Singh, I'll start with you first. What is colorectal cancer? If you could just explain it in some simple words for our audience.
The terminology colorectal cancer actually includes two organs. You all know that we have from our alimentary canal, we have stomach, small intestines and large intestine. So the distal most part, the lowermost part, it's the large bowel which we call in simple terms. So the colon is the tube which actually ends, and the lowermost part about 10 to 12 centimeters is rectum. And if you have cancers which arise in this organ, that is what is termed as colorectal cancer.
Dr. Vijay, when you speak about colorectal cancers, what are some of the risk factors, or rather, how do you get that? How are you susceptible to getting that?
I mean, there are lots of lifestyle causes of colorectal cancer, such as smoking, alcohol consumption, increased weight gain, mainly around your hips, sedentary lifestyle. There are a lot of dietary factors that can predispose an individual to getting colon cancer, such as taking low amount of fibers or fruits and vegetables, and having a diet high in red or processed meat. These are some of the modifiable risk factors for colon cancer.
Okay. And Dr. Patel, what are the symptoms? I mean, if I am a layman, I'm sitting at home, how does a person know that I might be susceptible to colorectal cancer? What do we need to do?
There are no specific symptoms sometimes of colorectal cancers, but most commonly when the patients come to us or patients having abdominal pain, sometimes there is alterations in bowel movements like alternate constipations and diarrhea. There is sometimes blood in stool also. Sometimes there is a yellow discoloration of the urine or sclera because of the sometimes sprayed to the organs like liver. So these are some sort of the symptoms which can lead diagnosis or to a suspicious of the colorectal cancers or colon cancers.
Okay. Dr. Ghosh, can you shed some light on some of the numbers? I mean, what are the statistics in respect to colorectal cancer?
Colorectal cancer, as per the data that we have from our country, it is like almost 4 to 5 persons per 1 lakh population gets colorectal cancer, and it is a disease that is largely concentrated in the urban population compared to the rural population. And if we look at its position in the chronological order, I think it comes somewhere around 7th or 8th most common cancer in our country.
Then one of the worrisome thing is that it is actually increasing now.
Yes.
Whatever the reasons have been well said by my colleague, but then definitely it is increasing, and there is a clear trend if you follow the cancer registries and the ICMR, that is Indian Council Medical Registry data. It is showing that from 2010-11 onwards it is showing a gradual or rather a significant increase, and factors are again, as others have mentioned, it is a lifestyle as well as a dietary extent disease.
But the good thing about this disease, if you may call it good, is because it takes some time to develop. It's not like which develops overnight, because they usually start off with what we call a polyp, and then the polyp becomes bigger and it becomes invasive. So very often people actually don't have symptoms. All they may have is the hemoglobin is a bit less. So in many situations, I mean, if there is a man who has a low hemoglobin, that's indirectly due to chronic blood loss. He may not have any symptoms. So even this awareness among people are very happy with the diagnosis of anemia, but one should really investigate, especially if it's a man with an anemia. He may be losing it in his
Exactly, that's the aim that I'm glad that you are all here to help us build this awareness, because that is the most important point here. Dr. Vijay, then what about let's go to the next step, prevention. What can people do to prevent?
Two aspects of prevention. One, as Ashish rightly pointed out, that it takes a long time for polyp to develop cancer. In fact, it can take as much as, usually takes about 10 years or plus. Because it takes such a long time to go from a precancerous polyp to a cancer, having routine surveillance colonoscopy once in say 5 or 10 years, depending upon your risk of developing colon cancer, would actually prevent diagnosing them at a much earlier stage, or preventing formation of cancer completely, because you take them out at a polyp stage when it's actually not become cancer. So I think that's probably the most successful way of preventing colon cancer. But we discussed some of the causes of lifestyle modifiable causes that can cause cancer, and having a healthy lifestyle. So doing regular exercises, maintaining a lean body weight, having diet which is less in red meat or processed meat and high in fiber, fruits and vegetables, and obviously no to smoking and alcohol. I think these things will go a long way in trying to reduce the burden of cancer, colon cancer in the society in general. But I think surveillance is probably one of the most important ways of preventing colon cancer.
Dr. Patel, when we move on from that, let's say I've done that, I've taken care, but some of the tests come up, and I'm regularly going and getting myself medically checked and all of that, but there is some detection that happens. What happens in the detection stage?
Once you suppose some person has detected with the cancer or any type of the cancer, first they have to consult with the specialty, concerned doctors. Then he will get rid from that cancer as a treatment, and second thing from mental stress also, because once patients come to us, we counsel them properly. What is the cancer actually, what are the stages, and what actually we should do. There are right now the invention is far more, and we can save the patients also in up to 3 stages, and we can extend the survival of the patients for up to 4 stages also. So properly investigate the patients. If suppose diagnosis or detected with the colorectal cancers, then we detect properly. There are some investigations, there are the list of the investigation, including the blood investigation, proper the imaging studies, and more important is biopsy, the tissue specimen examinations. These are the basic requirement to proceed further. How to stage the patients, how to go for the treatments, what are the drugs to be used, anything which can be decided with this battery of that investigation or battery of the test.
Dr. Jaideep, now I want to come to the next step. So how do you help in the diagnosis phase? How do you guide the patient so that the correct diagnosis is done at the correct time?
So what I feel is, in my clinical practice, almost 50% of the patients who presents to me for the first time are having advanced disease, which is either stage 3 or stage 4. And most of the times the stage 4 cancer, colon cancer, is not curable. We can just control the disease for a limited duration, but we cannot cure it just like the stage 1, 2 or 3. And the most common reason for that is ignoring one particular symptom and accounting it to some benign condition, like somebody is having piles, or somebody in the family who has had a piles for a long duration, has blood mixed with stool. So then they tend to account these symptoms to probably I'm having piles, so I really don't need to take care of it. I just modify my diet, or have some laxatives. It should be going away. These are the subtle initial symptoms which, if we look at and take care of it, we can diagnose colon cancer in a curative situation most of the times.
So there are 2 aspects. One is fear of going and being diagnosed with a disease. So that actually prevents a lot of people from contacting a healthcare professional. Second is denial. A lot of people feel that, okay, no, I am healthy, I have no symptoms, I am young, I cannot get a big disease like cancer.
Dr. Randeep, does it play an impact if somebody in the family has had a
So I was
history?
coming to that, yes, there is a genetic component also. And as one of the panelists mentioned, that there are modifiable risk factors, there are non-modifiable risk factors for cancer.
Right.
And unfortunately, genetic origin cancers are non-modifiable because it is in your genes. and there are few syndromes such as Lynch syndromes, and we call it as FAP syndrome. These are inherited in a predominant way from your parents, and these are not modifiable. And so someone who has at a younger age diagnosed with colon cancer, maybe you say less than 50 years, and or who has some first or second degree relatives who have suffered from either uterine cancers or colon cancers, in those we start suspecting that there may be a genetic origin.
You're watching an interesting discussion titled Merck Presents Let's March Ahead and Unite Against Colorectal Cancer. It's time for a very short break. Don't go anywhere. We'll be right back. Welcome back. You're watching Merck Presents Let's March Ahead and Unite Against Colorectal Cancer, where I'm in conversation with a panel of medical oncologists about colorectal cancer. So is there any advice, Dr. Vijay, to patients by way of age-wise? So maybe once I cross 30 or once I cross 40, I should do a certain level of tests with respect to colorectal cancer?
By and large, what we recommend is that most patients who are at risk, so who have the risk factors, such as obesity or smoking, drinking and so forth, above the age of 40 should go colonoscopy every 5 to 10 years and have an annual stool test for blood once a year. Okay. So that is a standard recommendation. But if you have a genetic defect, then it needs to be more frequent than that and probably much earlier on, and that would depend upon the age of the other family members who have been diagnosed, and it's usually 10 years before that. But it's in similar, it could be earlier and more frequent in those who have genetic risk, but by and large for most of the risk factors it's 50 plus.
So let's move one step further again now. And Dr. Patel, I'll come to you for this. Once we've crossed diagnosis and we go into detection, so if it is early stage, how is the treatment, or how do you handle the patient? What is the patient going through, and how does the doctor help in there?
If it is early stage, means stage 1, stage 2, and to a certain extent stage 3 also. And the colorectal per se is, or any cancer per se, it's a multimodality treatment protocols. It includes surgeon, radiation oncologist and medical oncologist, means chemotherapy specialist. So if it is in stage 1 or stage 2 or early colorectal malignancy or cancer, it should be treated with the surgery. And depends upon the reports of the surgical specimen that consist of the biopsy, we can final staging done. And according to that final staging, we can decide further treatment plans. Suppose patients require any chemotherapy aspect, any radiation aspect, particularly in the rectum, that is the lowermost part of the colon as earlier described. So depends upon the final histopathology, we stage the tumor, and according to that we will give further treatments in form of the adjuvant. So it will prevent the recurrence to the further developments.
One of the big misconception, if I can go back, is that people feel that if a biopsy is done by the doctor, it will spread everywhere.
Yes.
That is very one important message which I would like to give on this platform, that there is no scientific basis and no scientific proof in the medical literature which says that if biopsy is done to diagnose, because that is our prime basic step of diagnosis, and if someone is attempting to do a biopsy, there is no chance that it will spread over, and that is a very important message from my side.
Any other myths that you face as a doctor and this I want to take a minute to just go a little wider. So not just in colorectal cancer, but just in cancer. What are the biggest myths that doctors face in this space?
One myth that we commonly face is most of the people who come to us have a notion that once they are diagnosed with cancer, it's almost like a death sentence for them. Many of them, after diagnosis, don't even reach the oncologist, and trust me, many of them would turn out to be curable cancers. A cancer is not a death sentence. We have very good treatments for all stages of cancer as of now.
And the other myth is most people think that cancer treatment will involve a lot of side effects, and because they all hear stories from their neighbors, their family members, and because of these fear of side effects, a lot of them resort to alternative therapies. And there is a lot of propaganda in the media. You can see hoardings, and so people think that I will get cured, but they're all unproven therapies. I mean, till now there is no proven evidence that those alternative treatments lead to cure.
Cost also, it is not always necessary that it involves cost. For example, a simple surgery is not very costly of a colon. I mean, if it is an early colon cancer, it's a very simple surgery of removing it, and of course it is a major surgery, but it is not always necessary that early stage cancers, especially early stage colon cancer, treatment is not at all very costly.
But the important thing is also that if you nip it in the bud, as they say, if you catch it in the early stage, then you're ensuring that it's done and finished right there. Dr. Vijay, you know, one thing I wanted to talk to you about also was insurance. That's something that people don't talk about, but that's something really important.
I mean, the insurance take up in India is actually quite low compared to the Western world. I think only about 5% of the population is privately insured. Though about when you involve the government schemes and the corporate insurance, it goes up to about 20-25%, which is still quite low. Considering the cost of healthcare is going up, and there's no denying that no matter how much of subsidies the government brings in, the cost is going to go up, and it's going to consistently go up. I think every individual should take out an insurance cover. But the issue is not just about taking out the insurance cover. I think people need to know what is actually covered. So we face all the time that patient has taken out an insurance, and insurance coverage is there, it seems all legit and decent. But when they go to claim, there are hiccups with those claims, either because they've not declared the past medical history, which they should have declared. Sometimes there's a fine print which says that chemotherapy is covered, but then a supportive treatment like when we give bisphosphonates or hormonal therapy or immunotherapy, sometimes they come back as rejected, saying that these are not chemotherapy, albeit they are anti-cancer drugs which are quite expensive to go. So I think people need to be aware of what is actually being covered by the insurance companies, and I think I'm a strong proponent of that most people who can afford it should take out private insurance.
Dr. Patel, now again moving to the next stage, which is on a later stage diagnosis, if you get detection, once you come to know that unfortunately it's stage 4 of the cancer. If you could shed some more light on the later stage treatments.
As earlier we discussed, the stage 1, 2, 3 can be cured with the treatments, multimodality treatments, and earlier described that its stage 4 tumors cannot be cured, but it can be easily controlled.
That's right.
And if we control the stage 4 tumors or advanced malignancy, then patients can survive long with good quality of life. That is more important also.
Yes.
And right now in this today's era, the treatment of advanced malignancy, particularly colon advanced malignancy, is totally being personalized. What earlier we have described, that the biopsy, that is a tissue specimen of the cancer, and depends upon, there are availability of the lots of molecular or genetic testing has been done, and depends upon that genetic testing we can use some sort of the targeted molecules that will act directly on the cancer cells without affecting the normal body cells. So there will be very less side effects with more effect, and treatment being personalized treatments. Sometimes stage 4 treatments also include multimodality, which includes surgeon also to a certain extent. Radiation oncologists can be also participate when some sort of the palliation is required. And backbone of the stage 4 or advanced stage of the tumors treatments is particularly chemotherapy or targeted therapy, or the specific specialized genetic based treatments.
Treatment that might work for X might not work for Y, depending on obviously the different stages, but also depending on their the diagnosis of them. Is that something more that
Yes,
you see?
actually, you have actually partly said the answer. Personalized therapy is that A therapy may work for B person, but it may not work for C person. And to do personalized therapy, there are some targets which we identify in a particular individual, and that's why these personalized therapies are also have a synonymous name as targeted therapies. So we find a target, like there is a RAS target that is there in the colon, which we use it. So some patients who are having a gene which is silent and not having any abnormality may work with the targeted therapies, such as cetuximab is one of the targeted therapies which they use. Similarly, we have limited numbers of targeted therapies, and the other one is bevacizumab, which is used. So these are available. First of all, people think that this targeted therapy is a newer thing. So we have these drugs easily available in India. They do come with slightly or definitely cost. With the chemotherapy backbone we add it, but first we find that particular abnormality, and then if that abnormality is present or not present, then we choose the type of targeted therapy. For example, in colon cancer it is cetuximab or bevacizumab.
These agents actually even enable us sometimes to even cure stage 4 disease, because for example, if you have a tumor only in the liver which can't be resected because it's too big, and if you have, I mean, in the last 5 or 8 years we have seen that if you use the modern chemotherapy with one of these agents, you can actually convert an unresectable disease into resectable disease. and about 50% of those patients are alive at 5 years without disease. So things are changing, but what's important is access to these correct staging, diagnosis, and multidisciplinary team.
This is a question that's open to the panel. Your thoughts on the role of government and industry in this? How can these two verticals help the patients, the common man in this space?
There are the certain drugs, as earlier Dr. Randeep has said, some of the sort of the drugs which are the targeted therapies like bevacizumab or cetuximab, they are a little bit costly affairs. And till how much we have to give, it is not sure. Till the disease response, we should continue the drug therapy.
Right.
So the cost of the therapy is quite good.
Okay.
So the industry means the pharma company or the drug product manufacturers, they can give to a patient support programs depending upon their financial status. They can also help in the diagnostic, the certain diagnostic molecular testing also.
Right.
And from government setup, there should be some help policies, some cancer policies or some cancer claims that will help the common person to procure this costly medicine and to get good results.
We're just about running out of time, and I'd like to come to all the doctors. I'd start with Dr. Ashish and then move down the line. Just your final message, the final thought that you want to leave with our viewers here with respect to colorectal cancer. So, Dr. Ashish, we'll start with you.
Colorectal cancer is common, it's not very uncommon. The main thing is the early diagnosis and access to a multidisciplinary team. And so therefore, it's very important to take opinion from various stakeholders, various specialities, and then start your treatment rather than starting treatment in a hurry.
Right. So, Dr. Vijay.
Colon cancer is not a death sentence. Early stage colon cancer is curable. In fact, the vast majority of colon cancers are curable because they present quite early, even if they present with metastatic disease or stage 4. There's very good palliation and possibility of extend life significantly with personalized treatment exists. So I think I would suggest that if someone has any symptoms suggestive of colon cancer, they please go and visit the oncologist to get the right treatment.
I want to just stop you there for a second because you said metastatic. Could you just shed some more light on that word? We've not covered it so far.
So metastatic is basically what we have been talking about, stage 4 cancer, is when the cancer moves from colon to other parts of the body, such as the liver, the lungs, and the bones. When the cancer spreads to other organs, they generally classified as not curable or stage 4 cancers. And then the main aim for treatment is to palliate symptoms and improve life, quality and quantity of life.
Awareness regarding the colon cancer or colorectal cancers, healthy lifestyle, to get screening, proper screening. As such, there is no specific screening in India, but as earlier described, proper screening, and to access a proper multimodality team once it's diagnosed to a cancer. That is main funda to get rid from the colorectal cancers.
Fantastic. Dr. Randeep.
As I said, cancer I think is a lifestyle disease. So please maintain your lifestyle, be healthy, maintain your weight, and don't neglect your symptoms. We all have seen actually disasters happening.
Right.
Please be sensitive to your symptoms and please be open to the suggestions. And of course, you have to reach the right team if you have a suspicion. And that is not only to treat but also to rule out. To reach to an oncologist is not always for treating cancer. It is equally we have an important role in the community to rule out cancers also.
Better safe than sorry. Yes. We do that for that. Dr. J, the final word.
The most important thing is screening, which will definitely have an impact on the survival in colon cancer on a global scale.
Thank you so much, doctors, for that. Thank you so much for watching. You've been watching Merck Presents Let's March Ahead and Unite Against Colorectal Cancer. And we hope that we've been able to shed some more light on this disease and make you more aware about this. We also have a very special website called targetmycancer.com. Please do visit it to get some more information about colorectal cancer. Thank you so much for watching.
Partnered by Times Influence.